Cranial nerve examination. There are 12 pairs of cranial nerves: olfactory, optic, oculomotor, trochlear, trigeminal, obtusans, facial, vestibulocochlear, glossopharyngeal, vagus, spinal accessory, and the hypoglossal nerve. Let us examine each of these cranial nerves. After proper hand sanitization, we begin by testing the cranial nerve 1, the olfactory nerve. First, make sure that each nasal passage is patent by compressing one side of the nose and asking the patient to sniff through the other. Then ask the patient to close both eyes. Occlude one nostril and test smell in the other with substances like cloves, coffee, soap, or vanilla. Ask the patient to identify each odor. Test the smell on the other side. Normally, the patient perceives odors on each side and identifies them correctly. For testing the cranial nerve 2, the optic nerve, first test the visual acuity. Now inspect the optic fundi with your ophthalmoscope, paying special attention to the optic disc. Inspect each disc carefully for the bulgings and the blurred margins or any pallor and the cup enlargements. Also test for the visual fields by confrontation. Cranial nerves 3, 4 and 6, oculomotor, trochlear and the obtusans. Because these nerves work together so closely, they are examined as a group. Test the extraocular movements in the 6 cardinal directions of the gaze and look for the loss of conjugate movements in any of the 6 directions, which causes diplopia. Ask the patient which direction makes the diplopia worse and inspect the eye closely for the asymmetric deviation of movement. To determine whether the diplopia is monoocular or binocular, perform the cover-uncover test. Cover the patient's one eye, then the other. Next, also check for the convergence of the eye. Identify any nystagmus. Note the direction of the gaze in which it appears, the plane of the nystagmus, and the direction of the quick and the slow components. Ask the patient to fix his vision on the distant object and observe if the nystagmus increases or decreases. While palpating the temporal and the masseter muscles, in turn, ask the patient to firmly clench the teeth. Note the strength of the muscle contraction. Ask the patient to open and move the jaw from side to side. After explaining what you plan to do, test the forehead, cheek and chin on each side for the pain sensation. The patient's eyes should be closed. Use a suitable sharp object such as a pin or a cotton swab. To avoid transmitting infection, use a new object for each patient. While testing, occasionally substitute the blunt end for the point as a contrasting stimulus. Ask the patient to report whether each stimulus is sharp or dull and to compare the sides. If you detect any sensory loss, confirm it by testing their temperature sensation. 2 test tubes filled with the hot and the ice cold water are the traditional stimuli. You can also use a tuning fork as I am using here, which usually feels cool, and make it warm or cool with the running water. Dry it, then touch the skin and ask the patient to identify hot or cold. Next, by using a fine wisp of cotton, test the corneal reflex. Ask the patient to look up and away from you and approach from the opposite side out of the patient's line of vision. Avoiding the eyelashes, lightly touch the cornea with a fine wisp of cotton. Inspect for the blinking of both eyes, the normal reaction to this stimulus. The sensory limb of this corneal reflex is carried in the trigeminal nerve and the motor response in the facial nerve on the both sides. Inspect the face both at rest and during conversation. Ask the patient to raise both eyebrows, then Close the both eyes tightly so that you cannot open them to test the muscular strength. Show both the upper and the lower teeth. Then smile and then puff out both the cheeks. To examine the vestibulocochlear nerve, the acoustic and the vestibular. Assess hearing with the whispered voice test. Ask the patient to repeat number whispered into one ear while blocking or rubbing your fingers next to the contralateral ear. If the hearing loss is present, determine if the loss is conductive or sensory neural. Test for the air and the bone conduction using the RIN test and lateralization using the Weber test. Glossopharyngeal and the vagus nerve. Ask the patient to say ah or yawn as you watch the movement of the soft palate and the pharynx. The soft palate normally rises symmetrically, the uvula remains in the midline, and each side of the posterior pharynx moves medially like a curtain. Warn the patient that you are going to test for the gag reflex, which consists of elevation of the tongue and the soft palate and the constriction of the pharyngeal muscles. The spinal accessory nerve. Standing behind the patient, look for the atrophy or fasciculations in the trapezius muscle and compare one side with the other. Ask the patient to shrug both shoulders upward against your hand. Note the strength and the contraction of the trapezi. Then ask the patient to turn head to each side against your hand. Observe the contraction of the opposite sternocleidomastoid muscle and note the force of movement against your hand. The hypoglossal nerve. Listen for the articulations of the patient's words. This depends on the trigeminal nerve, facial nerve, the glossopharyngeal nerve, vagus nerve, and also the hypoglossal nerve. Inspect the patient's tongue as it lies on the floor of the mouth. Look for any atrophy or fasciculations. Some coarser restless movements are normal. Then with the patient's tongue protruded, look for the asymmetry, atrophy, or deviation from the midline. Ask the patient to move the tongue from side to side and note the symmetry of the movement.